Hi everybody, my name's Brian Erb and welcome to my presentation. Today I will be going over my research proposal for our 8th week of research utilization. So without further ado, let's jump right into it. The increasing population of older adults with one or more chronic health conditions has led to a greater need for the utilization of hospital services within this group. The resulting high levels of hospital admissions and readmission rates in this group has proven to be a pretty large burden to this nation's healthcare system by both increasing costs and reducing quality care outcomes. There has been previous research in this area to investigate other potential methods for reducing the issue, but the rates of readmission continue to remain high. There's a large growing need for improvement in how older adults are discharged from the hospital and care is transitioned to help reduce the likelihood of this vulnerable population from needing to be readmitted. This topic is significant to nurses for several important reasons. First, by exploring how effective a nurse-led care transition team is, we can further develop the latest evidence-based practice to promote an increasingly positive care transition experience for older adults. Research in this area will help to improve the care transition process for this population, which will improve patient care outcomes, safety, and patient satisfaction with the services provided. Also, by addressing the issue of frequent hospital readmissions in this population, we are preserving a nursing core value by advocating for our patients' well-being and ensuring continuity of their care. By focusing on this sensitive period of transition for the patient, nurses can play a vital role in helping to close the gap in care between various healthcare settings, which helps to provide a seamless transition that helps to reduce the likelihood of a readmission. Any relevant findings from this topic have the potential to improve nursing practice, healthcare policy, and the delivery of healthcare to older adults, ultimately leading to improved patient outcomes and greater quality of life. So my research variables are as follows. My independent variable is the implementation of the nurse-led care transition team. My dependent variable would be my rates of hospital readmission. My control variables would be my patient's demographics, which would be their age, their medical history, and the presence of a traditional transitional care approach. My research hypothesis would be hospitals that implement the nurse-led care transition approach will significantly reduce the rate of hospital readmissions seen in older adults. And my null hypothesis would be hospitals that implement the nurse-led care transition approach do not significantly reduce the rate of hospital readmissions in older adults. My problem statement is as follows. It is, in older adults, does the implementation of nurse-led care transition teams, as compared to the traditional approach, reduce hospital readmission rates within a 6-month period? And also, here are my research questions for my study. I have 3. Here is my first one. How does switching to a nurse-led care transition team influence the rate of hospital readmissions in older adults? Second question is, what are some of the key differences in how the nurse-led team transitions to care, and how does this compare to the traditional approach? Which methods appear to be most successful? Last question is, what do patients, caregivers, and healthcare providers think about the nurse-led care transition and its effectiveness in reducing hospital readmissions? And for my selected topic, I will be utilizing the nursing theory framework of the theory of planned behavior. The theory of planned behavior postulates that attitude, subjective norms, and perceived behavioral control predict intention, and intention along with perceived behavioral control predicts actual behavior. So through the modification of the nurse and patient's behaviors during the discharge process, I hope to create an improved system of care transition that will reduce the likelihood of the patient needing to be readmitted. So now let's begin going over my literature review of what I found out there regarding this topic and previous research done on it. So my first research article I went over was named A Mixed Methods Systematic Review of Nurse-Led Interventions for People with Multimorbidity. So this article investigated the nurse's involvement in the discharge process and how it might impact the patient's care outcomes. This is a mixed methods systematic review of studies involving nurse-led interventions of older adults suffering from chronic disease. The study concluded that nurses are well suited to provide individualized care interventions which fit the patient's specific needs, thereby improving their care outcome. However, it also cited that the complexity of adopting such an approach, the ongoing need for follow-up care, and collaboration between professionals, patient-centered outcomes such as quality of healthcare and health-related quality of life were mostly improved, with mixed effects on healthcare utilization, costs, mortality, and other outcomes. My second article was titled Contextualizing Evidence-Based Nurse-Led Interventions for Reducing 30-Day Hospital Readmissions Using GRADE Evidence to Decision Framework, a Delphi study. So this article used a modified framework approach to designate specific nursing interventions to discharge patients depending on their context. It recommended a partnership between healthcare facilities and social services to effectively bridge the gap during the care transition and reduce patient readmissions. Appropriate programs and medico-social collaboration may serve as potential policy solutions to overcome obstacles in implementing the recommended nurse-led interventions in local practice. Some limitations of this study might include purposive sampling, which may have led to selection bias. It also involved a predetermined framework for addressing interventions, which limited the nurse-caregiver decision-making process. And the third article was titled Transition Strategies for Hospital Discharge Used by Nurses, an Integrative Review. So this is an integrative review utilizing complete studies which were referenced with the keywords care transition or continuity of patient care or care continuity. The study investigated what were some of the most successful aspects of a nurse-led care transition team. Some of the most successful strategies employed by nurses during the discharge process included health education, med reconciliation, telemonitoring, discharge planning, counter-referral, and home visits. It stresses the need for clear and open communication between the professionals to collaborate and coordinate the patient's care. It also states the need for care to be continued after the patient's discharge to reduce the likelihood of a readmission. And next we had educational nursing intervention in reducing hospital readmission and the mortality of patients with heart failure, a systematic review and meta-analysis. So this one was a systematic review and meta-analysis that examined the role of nurse-led interventions for older adult cardiac patients through various randomized control trials, utilizing preferred reported items for systematic reviews and meta-analysis guidelines. It implicated the importance of having the nurse take a leadership role during the discharge process. Some of these roles included patient education, medication management, ranging follow-up care, which were all shown to significantly reduce hospital readmission rates. Evidence indicated that the use of home visits and telephone contact for patient follow-up and after hospital discharge for heart failure decompensation contributed to a reduction in hospital readmission rates and mortality and is a potential educational strategy for nursing practice. Some limitations of this one included short follow-up times and a smaller sample size, and also an absence of specific protocols in some of the randomized control trials reviewed. And then we had impact of a transitional care interventions on hospital readmissions in older medical patients, a systematic review. This systematic review investigated innovative methods of transitioning care from the hospital and the older adult population, which included having a nurse available to patients up to 7 days after discharge. Transitional care interventions reduce readmission rates among older medical patients, although the impact varies at different times of outcome assessment. The review concluded that interventions before, during, and after discharge were shown to positively affect readmission rates in patients. The study notes that methodological quality of the studies is low and that no specific interventions was found to be the most effective, which was likely due to the low sample size and wide range of interventions utilized. And lastly, we had effects of nurse-led transitional care interventions for patients with heart failure on healthcare utilization, a meta-analysis of randomized controlled trials. So this systematic review and meta-analysis of articles published between 2000 to 2020 focused on older adult heart failure patients who were discharged routinely versus discharged by a nurse-led transitional care intervention. The nurse's role plays a vital role in helping patients discover better ways of managing their symptoms, decreasing all cause of heart failure-specific readmission risks, as well as reducing the length of hospital stay. However, the study also revealed that the interventions did not have a significant impact on emergency room visits, and that greater research was needed to identify the most effective interventions for the most appropriate patient populations. Okay, so now that we've gone over the details of my research topic, let's go over what the design of any potential sort of experiment or study would look like. So this research proposal primarily concerns the older adult population suffering with one or more chronic health conditions recently discharged from care, and whether they have been readmitted for similar circumstances within a specified time frame. In addition to these criteria, the sample population should be discharged from care teams utilizing a nurse-led care transition approach. Ideally, a large enough sample size to account for any meaningful differences that may be found in hospital readmission rates and care outcomes should be utilized. This will be determined by using power calculations, which will help ensure adequate statistical power is available in the selected sample size. Recruitment of participants may be done by partnering with hospital organizations that utilize a nurse-led discharge approach to yield data on past patient rehospitalization rates, and by requesting the patients give feedback after their care experience. Information about the study and how to become involved, if eligible, may also be disseminated into areas where older adults are more likely to be, such as a senior living center. A small incentive for time and participation might also be included in the description of the study, which might include a gift card, a prize, or even just praise for helping advance the quality of medical care in this population. My sample population is appropriate for my study as it includes older adults who have experienced a recent hospitalization and were discharged using a nurse-led care transition approach. By comparing this population to other older adults who were discharged in a physician-led manner, I will be able to determine the degree of difference in terms of the likelihood of hospital readmission following discharge, the care outcome, and the patient's level of satisfaction with the care they received. By strictly adhering to my study's inclusion criteria, I can ensure a more accurate representation of my sample population's unique considerations. Participants in this study must first meet the required criteria to be eligible to participate. First and foremost, anyone who participates in this study will need to be an older adult, ideally age 65 or older, who has recently been hospitalized or discharged from a hospital using a nurse-led care discharge team. The subjects may be fully informed about the study's purpose, the role of the nurse-led discharge team, and what their involvement will entail. Any participants in the study should have first given express consent for their involvement after having the study explained fully in detail in an easily understandable manner. Patient information and privacy practices will be clearly described before agreeing to participate in the study, and the patient's right to autonomy to choose whether they will or will not participate will be upheld. A small incentive for full participation will be provided, which may include something like a $25 gift card to a select store or restaurant. Data will be collected primarily in the form of quantitative data, but there will be some opportunity to provide qualitative feedback. This will include surveys regarding the success of the care transition process, which will be administered to older adult patients and the healthcare professionals tasked with their care delivery. In the surveys to be administered to the older adult patients, a structured questionnaire will be developed to focus on their care outcomes and experience during the care transition, post-discharge care, and whether they were readmitted within a short time frame. The surveys will be conducted through face-to-face interviews, phone calls, electronically, or in paper format, depending on the participants' preferences. The researchers will develop a separate questionnaire for the healthcare professional surveys to gather data on how they viewed the nurse-led care transition team and its effectiveness on patient outcomes and hospital readmissions. These interviews will provide room for any feedback the care team may want to provide with what they saw as being the most helpful or unhelpful in the nurse-led care discharge approach. These surveys will also be administered similarly depending on the individual's preferences. Using multiple regression analysis is the most appropriate approach for data interpretation. This data analysis can assess the relationship between my independent variable, or the implementation of the nurse-led care transition team, and my dependent variable, or rate of hospital readmissions, while also controlling for the influence of control variables such as patient demographics or the presence of traditional transitional care approaches. Regression analysis will also help us to quantify the degree of significance in my relationship between the independent and dependent variables by examining the beta coefficient. This value, if found to be statistically significant, will determine just how effective or ineffective the implementation of our independent variable is, depending on if it is a positive or a negative value. In the case of the study, an increasingly positive value would indicate that the implementation of nurse-led care transition teams is increasing hospital readmission rates. In contrast, a negative value would indicate the opposite. To increase the reliability of any findings from the study, the research team should first establish a solid data collection process. Interview questions should be structured to semi-structured so that participants can yield primary quantitative data about the success of their discharge approach, with some room to expand on how their experience with the approach was compared to the traditional approach. I will help to mitigate any potential sources of error by ensuring that my personnel in charge of data collection are formally trained on any protocols to be followed, and following up during this process with regular meetings to assess the effectiveness of their data collection. The first step in ensuring the validity of any findings from this study is strictly adhering to the inclusion and exclusion criteria listed. Failure to follow these criteria will result in erroneous findings that will steer the research from its intended course. The inclusion criteria are in place to enhance the study's generalizability and validity of any findings from the population and intervention in question. Another critical step in ensuring validity is ensuring that my measurement tools used in my study are appropriately calibrated and used correctly. This can be validated by initially checking the instrument, testing its functionality, and ensuring that it's correctly calibrated. In addition, the research team will need to be trained to use any equipment and should verify their ability to do so by giving return demonstrations. To better respect our patients' natural rights, we have created standards to follow while conducting research. One of the essential standards for us to follow when involving a patient in our research is to first provide them with comprehensive information surrounding any procedure, test, or treatment that they might choose to be a part of. Only after our patient has been informed of all pertinent information and has verbalized their understanding can we then have them sign a consent form to participate in the research officially. Another critical component of research or healthcare provision in modern times is respect for the patient's privacy and anonymizing any information that can be directly linked to them. This practice has been put in place for many reasons, not least of which is to respect the patient's right to confidentiality regarding their health status and information. The individual carrying out the research should have a strong sense of integrity, as many of the patients they treat are in very sensitive and vulnerable life positions. The research team will be regularly audited by an institutional review board, which will either approve the research project, make adjustments as needed, or terminate it should the team be found to conduct research unethically. Well, everyone, that's it for my research proposal. Let me know what you think, if it sounds like something that might bear some investigation, or if I'm just wasting my time here. Once again, my name's Brian Erb. It's been a pleasure. You'll have a great day.